I want you to think about the last healthy meal you were proud of. Maybe it was a salad with fresh greens. Maybe it was a vegetable soup you made from scratch. Maybe it was a glass of beet juice you drank specifically because you had read it was good for your heart. You went to bed that night feeling like you had done something right for your body. You felt responsible. You felt safe. And then imagine waking up the next morning and something is wrong. Your words will not come out the way you intend them. One arm feels like it belongs to someone else. The room is spinning in a way that has nothing to do with how fast you stood up. Most people in that moment think about everything except the vegetables they ate for dinner. But after 25 years of treating older adults with serious neurological and cardiovascular conditions, I can tell you that some of the most heartbreaking conversations I have had with patients and their families began not with a history of fast food or cigarettes or obvious neglect. They began with a history of genuinely healthy eating that the aging body was no longer processing the way it once did. Today, I am going to walk you through 7 everyday vegetables that can quietly raise stroke risk in adults over 60. Not because these foods are inherently dangerous, but because the aging body handles them differently. And that difference, when it goes unrecognized and unaddressed, can have consequences that no one saw coming. Stay with me through all 7. The final one on this list is something most seniors eat multiple times a week, and it carries a risk that almost nobody is talking about clearly enough. My name is Dr. Williams James. I have been in clinical medicine for 25 years, with a significant focus on brain health, stroke prevention, and the unique way the aging body responds to food, medication, and lifestyle. I have spent more time than I care to count reviewing the dietary histories of stroke patients who had no idea that what they were eating was contributing to what happened to them. That pattern is what drives this conversation today. Not fear, not restriction, awareness. Because awareness is what changes outcomes before they become irreversible. Stroke is among the most devastating health events an older adult can experience. It is sudden. It is often without warning. And the damage it leaves behind, to speech, to movement, to memory, to independence, can be permanent. According to the Centers for Disease Control and Prevention, someone in the United States has a stroke every 40 seconds. And the risk increases sharply with age, with adults over 65 accounting for the majority of stroke hospitalizations each year. The standard conversation about stroke prevention focuses almost exclusively on the obvious: high-sodium processed foods, saturated fat, alcohol, smoking, physical inactivity. That conversation is important and it is correct, but it is incomplete. What it consistently fails to address is the way the aging body processes even genuinely nutritious foods differently than it did at 40 or 50. After 60, kidney filtration slows significantly. Blood vessel walls lose their youthful elasticity and become stiffer and more fragile. The body's ability to regulate fluid balance weakens. Blood sugar management becomes less efficient. And the majority of adults in this age group are managing at least one chronic condition with prescription medication, many of which interact in clinically significant ways with specific compounds found in common vegetables. Research published in cardiovascular and nutritional medicine journals has consistently shown that stroke risk is shaped not by single dramatic choices, but by patterns, timing, food and medication combinations, and the cumulative effect of daily habits on blood viscosity, blood pressure stability, and cerebral oxygen delivery. Understanding those patterns is not frightening. It is empowering, and it begins right here. Before I name the 7 vegetables, I want you to understand one central concept that ties everything together. Think of your circulatory system after 60 as a network of aging pipes that have carried fluid under pressure for decades. The walls are less flexible than they once were. The internal diameter has narrowed in many places. The pump driving the system, your heart, is still working faithfully, but with less reserve capacity than it had 20 years ago. In that system, 3 things create the most immediate danger for the brain: blood that becomes too thick and moves too slowly through those narrowed passages, blood pressure that swings too high or drops too low, both of which deprive the brain of the steady oxygen supply it depends on, and disruption to the delicate balance between clotting factors and the medications many seniors take specifically to manage that balance. What you eat for dinner is still being processed during the overnight hours when you are not conscious, not hydrating, and not able to notice early warning signals. That overnight processing window is when several of these 7 vegetables create their most significant risk. And that is what makes this conversation so important to have before the morning it matters. The first vegetable is one that has earned a reputation as one of the most protective foods on earth. And that reputation is largely deserved, with one critical caveat that most seniors have never been told. Spinach. Spinach is genuinely rich in iron, magnesium, folate, and antioxidants that support cardiovascular and neurological health. None of that changes after 60. What changes is the interaction between one of spinach's most abundant nutrients and one of the most commonly prescribed classes of medication in older adults. Spinach is one of the most concentrated dietary sources of vitamin K, the nutrient that regulates the body's ability to form blood clots. For a healthy adult managing no medications, abundant vitamin K is a benefit. But for the significant and growing number of adults over 60 taking anticoagulant medications such as warfarin, the relationship between vitamin K intake and medication effectiveness is one of the most delicate balancing acts in all of clinical pharmacology. Warfarin works by blocking the activity of vitamin K-dependent clotting factors. When vitamin K intake rises significantly, it partially counteracts the medication, allowing the blood to thicken beyond the intended therapeutic range. When blood thickens in already narrowed, stiffened vessels, the risk of clot formation in the cerebral circulation rises meaningfully. The danger here is not consistent consumption of spinach. It is inconsistency. Eating large amounts of spinach one week and very little the next creates unpredictable swings in how effectively anticoagulant medication works. Clinical guidelines specifically advise patients on warfarin to keep their vitamin K intake stable, not necessarily low, but stable, so that medication dosing can be accurately calibrated. If you take blood thinners, keep your spinach consumption consistent week to week. Never go from no spinach to a large daily smoothie without speaking with your physician. And ensure your medication levels are being monitored regularly through appropriate blood work. Spinach can remain part of your diet. What cannot remain is the assumption that more is always better. The second vegetable is one that millions of older adults have adopted specifically for its heart and brain benefits, often on the advice of health publications that did not tell the complete story. Beets. Beets are rich in dietary nitrates that convert to nitric oxide in the body, relaxing blood vessel walls and naturally lowering blood pressure. For a healthy adult with no cardiovascular medications, this is a genuine and documented benefit. But for a senior already taking antihypertensive medications, adding the vasodilatory effect of significant beet consumption creates a compounding effect that can push blood pressure below the level the aging brain needs to sustain adequate oxygen delivery. The brain is the most metabolically demanding organ in the body. It consumes roughly 20% of the body's total oxygen supply, despite representing only about 2% of body weight. It depends on a continuous, steady pressure of oxygenated blood to function. When blood pressure drops too far, even briefly, cerebral perfusion, the flow of blood through the brain's vessels, becomes inadequate. In a younger brain with elastic, responsive vessels, a brief drop in pressure is corrected quickly. In an aging brain with stiffer, narrower vessels, that correction is slower and less reliable. When blood moves sluggishly through narrow vessels during the low-pressure overnight hours, it is more prone to thickening and clot formation in the small cerebral arteries. The stroke that results from this mechanism is called an ischemic stroke, and it is the most common type, accounting for roughly 87% of all strokes. If you consume beets regularly, eat them earlier in the day when blood pressure is naturally at its daily high, rather than its overnight low. Avoid pairing beet juice or large beet portions with your blood pressure medication at the same meal, and inform your physician about your regular beet consumption so they can factor it into your medication management. The third vegetable is one that most people would never consider even remotely risky, precisely because it is almost entirely water. Celery. Celery functions as a natural diuretic, encouraging the kidneys to release water and sodium more rapidly than they otherwise would. For a healthy, well-hydrated younger adult, this effect is negligible. For a senior over 60 whose kidneys already filter more slowly, whose thirst signals are already diminished, and who may be taking prescription diuretics for blood pressure or heart conditions, Celery consumed in the evening adds a dehydrating effect to the overnight hours when fluid is not being replaced. Dehydration is one of the most consistently underestimated stroke risk factors in older adults. When blood volume decreases, blood concentration increases. Thicker blood moves more slowly. Slower blood in narrower, less elastic vessels is more prone to forming the small clots that can occlude the cerebral microcirculation during sleep. Research has established that mild to moderate dehydration meaningfully increases blood viscosity, and that older adults are disproportionately vulnerable to the neurological consequences of even modest dehydration. The combination of a natural diuretic food, a prescription diuretic medication, reduced overnight hydration, and age-related changes in kidney function creates a risk profile that is greater than any one of those factors alone. Enjoy celery earlier in the day and balance it with consistent water intake. If you are taking diuretic medications, mention your celery consumption to your physician. Never eat large amounts of celery as a late evening snack, particularly if you notice morning dizziness, dark urine, or frequent nighttime urination, all of which may signal that your body is losing fluid faster than it is replacing it. The fourth vegetable has achieved perhaps the most extraordinary health reputation of any food in recent decades, and that reputation has led millions of older adults to consume it in amounts and forms that their bodies are not well equipped to manage. Kale. Kale is genuinely nutrient-dense, rich in vitamin C and K, calcium, and antioxidants. But kale belongs to the cruciferous vegetable family and contains naturally occurring compounds called goitrogens, which interfere with the thyroid gland's ability to absorb and utilize iodine effectively. When goitrogen intake is high and consistent, particularly from raw kale consumed in large daily quantities such as blended smoothies, the thyroid's function can become subtly suppressed over time. The thyroid gland regulates the metabolic rate of virtually every system in the body, including the cardiovascular system. When thyroid function declines, even modestly, the consequences for circulatory health include elevated cholesterol levels, slowed heart rate, and changes in blood consistency that increase clotting tendency. Research has identified subclinical hypothyroidism, thyroid function that is reduced but not yet meeting the clinical threshold for diagnosis, as an independent risk factor for cardiovascular events, including stroke in adults over 60. Cook kale before eating it. Cooking significantly reduces goitrogen activity while preserving the majority of kale's nutritional value. Avoid consuming large quantities of raw kale daily, particularly in blended form where large amounts are consumed in a single sitting. And if you experience unexplained fatigue, weight changes, cold sensitivity, or cognitive slowing, ask your physician to check your thyroid function, particularly if raw cruciferous vegetables have been a significant part of your diet. This is a good moment to pause and remind you that if this channel is giving you information that genuinely changes how you think about your health after 60, subscribing takes 5 seconds and means you will never miss a conversation like this one. I bring honest, research-based health information to older adults every single week, and I want you to be part of that community. Tap subscribe now, and let us keep this conversation going. The fifth category is not a single vegetable, but a form of vegetable consumption so common in older adult households that it deserves its own place on this list. Canned vegetables. Canned vegetables are for many seniors the most practical, affordable, and consistent source of vegetables in their daily diet. And the vegetables themselves, green beans, corn, peas, carrots, are nutritionally valid choices. The problem is not the vegetables. It is what they are preserved in. Many standard canned vegetables contain between 500 and 900 milligrams of sodium per serving. For a senior eating 2 servings of canned vegetables as part of an evening meal, that single dietary decision may represent the majority of their recommended daily sodium intake in one sitting. And unlike younger adults, whose kidneys can filter and excrete excess sodium efficiently, the aging kidney retains sodium more readily, allowing it to accumulate in the bloodstream. Excess sodium draws water into the vascular space, increasing blood volume and applying additional pressure to already stiffened arterial walls. Over time, that sustained pressure damages the vessel lining, triggering inflammatory repair responses that include the formation of arterial plaques and the accumulation of clotting factors at sites of vessel wall injury. This is not a theoretical mechanism. It is one of the most extensively documented pathways to stroke in the medical literature. Choose low-sodium or no-salt added canned vegetables whenever possible. Drain and rinse standard canned vegetables before eating, a simple step that research has shown can remove up to 40% of their sodium content. Better still, transition to unsalted frozen vegetables, which are nutritionally comparable to fresh and carry none of the sodium burden of standard canned products. And if you are being managed for hypertension, ask your physician to help you identify a specific daily sodium target and track your intake against it consistently. The sixth vegetable is one whose health benefits are so firmly established in popular understanding that questioning it feels almost heretical. Garlic. Garlic contains sulfur compounds, most notably allicin, that have natural anticoagulant and blood pressure lowering properties. These are genuine, documented benefits for cardiovascular health. But for the substantial proportion of adults over 60 who are already taking blood-thinning medications or antihypertensive drugs, garlic's pharmacologically active compounds do not simply complement these medications, they add to them. When the combined blood-thinning effect of garlic and anticoagulant medication exceeds the therapeutic range, the blood may become too thin. Vessels that are already fragile from decades of pressure and age-related change become vulnerable to hemorrhagic events, small bleeds in the brain's vasculature that can be just as devastating as clot-based strokes and are often more difficult to treat. The risk is substantially higher with concentrated garlic supplements than with culinary amounts of cooked garlic in food. Cooking reduces allicin concentration meaningfully. For most seniors taking standard medication regimens, moderate amounts of cooked garlic in daily meals are unlikely to create significant risk. Concentrated garlic supplements, however, should not be taken without explicit discussion with a physician who knows your complete medication list. Watch for signs that your blood may be thinning beyond the intended therapeutic range. Unusual bruising, nosebleeds that are difficult to stop, persistent headaches, and unexplained fatigue can all be early indicators. Report any of these symptoms to your physician promptly. The seventh and final vegetable is the one I told you about at the beginning of this video. The one most seniors eat multiple times every week without any awareness of its specific risk profile for the aging brain and circulatory system. Tomatoes. Tomatoes are rich in lycopene, a powerful antioxidant with genuine cardiovascular protective properties, and their place in a balanced diet is not in question. But tomatoes belong to the nightshade botanical family and contain compounds including solanine, histamines, and tyramines that can, in susceptible older adults, trigger unpredictable vascular responses. These compounds influence the tone of blood vessel walls, causing dilation or constriction in patterns that the aging cardiovascular system, with its reduced regulatory flexibility, handles less smoothly than a younger one. Tomatoes are also significantly acidic, and that acidity influences electrolyte balance, particularly levels of magnesium and calcium, both of which are critical for stable nerve conduction and vascular muscle function. When eaten in large quantities in the evening, particularly in the form of heavy tomato-based sauces and soups, the combined effects of vascular reactivity and electrolyte disruption can produce blood pressure instability during the overnight hours. Cook tomatoes rather than consuming them raw in large quantities at dinner. Cooking reduces solanine levels and actually increases the bioavailability of lycopene, simultaneously reducing the vascular reactivity risk while enhancing the antioxidant benefit. Pair tomato-based meals with magnesium-rich foods, such as pumpkin seeds or legumes. And if you have ever noticed headaches, flushing, or unusual dizziness following meals with heavy tomato content, bring that observation to your physician. Let me tell you about a patient I will call Harold. He was 73 years old, a retired school principal from the Midwest, and a man who had taken his health more seriously than almost any patient I had seen in years. He had eliminated red meat. He exercised 4 days a week. He took his medications without fail and had read extensively about nutrition and brain health. Harold's evening routine was, by any conventional measure, exemplary. A large spinach and kale salad dressed with olive oil, a bowl of homemade tomato soup, canned green beans as a side because they were convenient and he lived alone, a glass of beet juice that he drank specifically because he had read about its benefits for cerebral blood flow, and a garlic supplement he had added 3 months earlier, after an article suggested it supported cardiovascular health. He took his warfarin and his blood pressure medication with dinner every evening. Every single component of that meal had been chosen deliberately. Every item had been selected because Harold believed it was fighting for his brain and his heart. Nobody had ever sat down with him and explained what those choices were doing in combination, in the evening, inside a 73-year-old body that was already managing anticoagulation therapy and antihypertensive medication. One Tuesday morning, Harold's neighbor, who checked on him regularly, found him in his kitchen unable to form complete sentences. His right hand was gripping the counter, and he could not explain why. At the hospital, imaging revealed an ischemic stroke affecting the language center of his brain. His INR, the measure of how effectively his warfarin was working, was outside its therapeutic range. His blood pressure had dropped significantly overnight. His blood work showed electrolyte imbalance. No single food had caused Harold's stroke. What had caused it was a pattern. A combination of vitamin K from his spinach and kale interacting with his warfarin, the compounding blood pressure lowering effect of his beet juice and his medication, the overnight dehydrating effect of his canned vegetables' sodium load, and the additive blood thinning effect of his garlic supplement, all converging in the overnight hours when his body had no conscious awareness to notice the warning. In his recovery, Harold told me something I think about often. He said, "I spent years trying to eat my way to a healthy brain. Nobody told me I needed to understand my body before I could do that safely." That is the lesson I carry from Harold into every conversation I have about food and aging. Good intentions are not enough. Understanding is what protects you. Here is what I want you to do with everything you have heard today. Review your evening meals this week. Identify which of these 7 vegetables appear regularly after 6 in the afternoon, and consider shifting them to earlier in the day when your body is actively hydrating and your circulatory system is at its most robust. Make a complete list of every medication you currently take, including supplements, and bring that list to your next physician or pharmacist appointment, alongside a description of your typical daily diet. Medication and food interactions in older adults are one of the most underaddressed areas of routine medical care, and your care team cannot manage interactions they do not know exist. Hydrate consistently and deliberately throughout the day. Do not wait for thirst to tell you to drink water, because after 60, that signal is no longer reliable. Aim for regular fluid intake from morning through early evening, and make a habit of drinking a full glass of water with your evening meal, regardless of what you are eating. If you have experienced unexplained morning dizziness, brief confusion, weakness on one side of the body, slurred speech, or sudden visual changes, do not dismiss these as normal aging. These are potential signs of transient ischemic events, and they require prompt medical evaluation. The earlier that conversation happens, the more options are available to protect you. And if concentrated vegetable supplements of any kind are part of your current routine, whether garlic, beet, spinach, or kale in supplement form, have an explicit conversation with your physician about whether those supplements interact with your current medications. What is available without a prescription is not the same as what is safe for every individual taking a specific combination of prescribed drugs. The 7 vegetables we discussed today are not your enemies. They were not your enemies at 40, and they are not your enemies now. What has changed is the body receiving them, and respecting that change is not a concession to aging. It is one of the most intelligent and proactive things you can do with the knowledge you now have. Timing, consistency, awareness of medication interactions, hydration. These are not complicated interventions. They are simple, free, and available to you starting with your very next meal. Your brain has been working for you every day of your life. It has stored your memories, guided your decisions, and carried everything that makes you who you are. It deserves the specific, informed care that only comes from understanding how your body has changed and what it needs now. Tell me in the comments which of these 7 vegetables surprised you the most, and tell me whether you will be changing anything about when or how you eat them. I read every comment, and your answers shape every conversation I bring to this channel. If this video reached you in a way that matters, please share it with someone you love who is over 60 and eating these foods daily without this information. That share is not a small thing. It may reach someone before the morning that changes everything for them. Subscribe for more honest, research-grounded conversations about protecting your brain and your health after 60. Next time, we are covering the 5 silent signs of a mini-stroke that most adults over 60 are dismissing as tiredness or normal aging, and what to do the moment you notice any of them. That is a conversation you genuinely cannot afford to miss. Everything shared in this video is general medical and nutritional information based on published research and clinical experience. It is not personal medical advice and is not a substitute for care from your own physician or specialist. Every individual's health situation is unique, particularly for those managing chronic conditions or taking prescription medications. Please consult your doctor or a qualified healthcare provider before making changes to your diet, supplement routine, or medication schedule. Your physician knows your full medical history. Bring this information to that conversation. That is where safe and personalized health decisions begin.